I probably originally got drawn to medicine just from loving science, and honestly, I kind of followed this natural path through college, kind of on my way to medical school, and then in medical school I started getting a little bit exposed to orthopedics through just the typical rotations that we do, and I loved orthopedics. First of all, I would say we're some of the happiest surgeons out there, and maybe other surgeons wouldn't agree, but I think it's an extremely rewarding specialty, partially because the vast majority of what I do is elective. It's patients who are choosing to get better. They're choosing their quality of life. They're actively making the decision to get better, whereas there are some other fields in medicine where you can imagine you don't choose to get sick with cancer, you don't choose to have a heart problem, so orthopedics is really unique in that sense. I get to give my patients a lot of choice. I can say, you can choose X or you can choose Y, and I think when the patient has made that active decision, it makes them so engaged in their recovery, and it's really just so much fun to watch them get back to their level of function after the procedure. It's interesting when you're a surgeon, you never want to take for granted that it becomes routine to you, right? Because every patient, it's not routine to them. For every family, it's something foreign. And so you do have to have a healthy dose of just kind of remembering what this means to the family and what their experience is. So for us, it's a day-to-day activity. And for everyone else, you have to understand the amount of anxiety and stress that goes into that. I think when you go into surgery, you have to have a nice balance of confidence and respect for potential issues, meaning you never go into a surgery feeling too relaxed. You don't want to be stressed, you don't want to be tense, but you want to be aware. When you're a surgeon and you're in a room and you have a patient under anesthesia, there's a lot of activity, right? There's nurses, there's an anesthesiologist, there's a surgical tech, there's people assisting you, and you really have to kind of control the room and understand that this is your patient, this is the person that you consented for the procedure, and you kind of have to run the show and just make sure that things go smoothly and according to plan. So I always try to say, I think a patient does appreciate when you have some level of confidence about it without being cocky, and I think deep down, every surgeon goes in, with just a little healthy level of just awareness about kind of what's coming with the case and making sure that things go exactly according to plan.